Thank you, Taffy. So, in the following slides, we are going to look at processing the main cues we've collected. As we can see, Peter is showing quite a few abnormal findings that are outside of that normal body parameters and signs of deterioration as well, heading towards septic shock. So, that requires early identification so we can put into place interventions and evaluate and ensure that patient safety as it is a life-threatening case. And we would initiate that MET call early on here. So as we can see, he has a high respiratory rate and his heart rate is high too. We can see his SpO2 levels have dropped. In terms of his bloods, his CRP and white cell counts are high, indicating that infection as well. So, as we're all quite familiar with the 4 phases of septic shock, we can see clear signs of septic shock in Peter's current state and clearly identify that he has already reached that progressive state, which could lead to acute respiratory failure soon. Now, in terms of the signs and symptoms that Peter is currently presenting, shows that he's already passed that compensatory stage, and we've already reached that progressive stage. As for that compensatory stage, Peter's body activated that sympathetic system in attempting to maintain homeostasis, and hence, as to compensate for that low oxygen, we observed Peter have tachycardia with increased heart rate to compensate for that decreased cardiac output, and tachypnea with his increased work of breathing, vasoconstriction to his vital organs. We also see the activation of the renin-angiotensin-aldosterone system, a critical physiological mechanism for preventing that systemic hypertension and allowing for oxygenation and bronchodilation, which was initiated through that system. However, we see that Peter's body has, reached that progressive stage, with his most concerning findings being that change in neurological status. He's quite confused. His saturations are 98% on 2 liters on nasal prongs as well. So we see that in terms of his skin, it's quite cool and clammy, as well as his capillary refill having decreased, as his body's compensating mechanisms have failed due to that lack of perfusion, and it seems to be getting worse. So he's got a high heart rate, which is thready, and a low blood pressure as well of 97/60, and his temperature is also 34.9 degrees. And these are all cues for us to act immediately, as they're all basically the late signs of septic shock, where Peter is in that progressive stage. So we can also see he is experiencing respiratory acidosis, and this indicates that his lungs are unable to remove that carbon dioxide produced by his body, as he's not getting that sufficient oxygen into the body to produce energy, because of the aerobic metabolism generates ATP through use of oxygen, and it does it through an efficient manner, but because of its reliance on oxygen, it has to compensate for its turn to anaerobic metabolism, which does not need oxygen but only creates 2 ATP molecules per glucose molecule, which is not efficient or effective, but it also ends up producing that lactic through the process, and lactic acidosis results in overall metabolic acidosis for Peter. So we'll see this in his vessels becoming more permeable, and so there is that widespread inflammatory response where we see the fluid shift from the intravascular hypovolemia and tissue edema. So we can see clearly the body is heading towards that refractory stage in which the damage is irreversible and could basically result to multi-organ dysfunction syndrome. So in Peter's case, in terms of treatment interventions, we would include fluid resuscitation, antibiotics, and oxygen to replace that volume loss and take control of that hypoxia, and reverse the shock state that we're in. So we can see clearly Peter is experiencing septic shock secondary to aspiration pneumonia and experiencing hypovolemia as a result also. We can see this in his anaerobic metabolic state, and if we don't manage his conditions now, we will continue to see severe changes due to that low perfusion, and that would ultimately lead to that acute respiratory failure and multi-organ dysfunction syndrome, with irreversible damage as due to that continually impaired cellular metabolism. So that is why it is crucial to start that IV antibiotics and intravenous fluids to restore the body fluids. Now, dyspnea, hypoxemia, and cracked pulse on the lungs, auscultation are common features of aspiration pneumonia and signs of septic shock. Oxygen therapy, coughing, deep breathing exercises, and sufficient hydration, as well as suctioning, are some of the supportive interventions that we could implement. So we can see Peter's already on 2 liter oxygenation through that nasal prongs, and we could increase that to about 4 or 5 liters to help as well.